Gross. I am a licensed psychologist at the Utah Center for Evidence-Based Treatment. So a little bit about me. I completed my doctorate degree at the University of Indianapolis in Indianapolis, Indiana. And so it was a PsyD program and a generalist program. So I do work with all ages, but I did specialize my training in children and adolescents. And so I did my internship in Salt Lake City at Primary Children's Center for Counseling. And then I did my postdoctoral fellowship at Boys Town Center for Behavioral Health in Omaha, Nebraska, which is my hometown. And now I'm back out in Salt Lake City again. And so what I'm going to be talking about today is the parent-adolescent relationships, talk about some factors contributing to the changes in that relationship and ways that parents can improve them. And so I am curious kind of who is all with me today, because it sounds like I have some mental health providers, maybe some parents or both, or maybe my mom or fiance are on here too watching. So I'm gonna have a poll sent out just to kind of see who my audience is and see when talking about this if I can gear it towards one more than the other. Okay, so thanks for responding, guys. It looks like I have a decent mixture, but maybe more providers. So I'm going to start out by talking about the pros of that positive parent-adolescent relationship. To me, that's kind of like the why. Why does this matter? Why am I even talking about this? And then I'm going to talk about the adolescent development, because I think that's an important factor that affects that relationship. It also gives us a little bit of understanding of what's going on during this time, so that understanding can help us maybe normalize some of those things that are occurring. Talk about some of those changes that occur from that parent-child to parent-adolescent relationship, then some other additional factors that affect that relationship. I'm also, if I have time, I'm going to talk about some pieces of conflict in that parent-adolescent relationship, because I think there's also some great suggestions for ways to improve that relationship related to conflict. And then at the end, I'm going to talk about some ways to improve that relationship, but I am also going to work that in throughout the presentation. So the why does it matter? I think sometimes we get these stereotypes that parent-adolescent relationship doesn't hold as much weight or isn't as important as peers during this time. And it is true, there tends to be this kind of tendency to be highly influenced by peers, though that parent-adolescent relationship is still really important during this time. And research has shown that high quality and positive parent-adolescent relationships tend to predict lower levels of adolescent depression, fewer delinquent problems, and it can also help protect against antisocial behaviors in families that have any marital disruption or conflict. I think that's something where research has shown that anytime there's a disruption to that family system, it's pretty normative and typical for some children and teenagers to have this more of like these delinquent pushing back behaviors. And so if there's a higher quality and positive parent-adolescent relationship, even just one with one of those parents, it can be a protective factor against these pieces. So it's still important and still matters. And looking at the development of the teenage brain, it's this period for teenagers is a really big time of rapid cognitive, biosocial, or biological and psychosocial changes. And so one of those changes during this time is that they have an increased activation in their limbic structures. So that's their amygdala, hypothalamus. They have an increase in release of hormones during this time. And so this has been related to an increase in sensitivity to negative emotions and emotional ability during this time. So you might see the teenager maybe having more of like a pessimistic attitude about things or not seeing things in as much of a positive light. And to a certain extent, this is normative for them. They also have increased reward sensitivity. So that means I want it now, I want to feel good, I want those things that feel really rewarding to me. And so that can mean that they're having more experimentation or risk-taking that they're doing during this time. And so with this, you might see some more of those behaviors. But at the same time, their prefrontal cortex, so that's the part that's involved in that self-regulation and inhibitory control. So those pieces, it's that part of that brain is maturing, but it's maturing at a gradual rate. And so there's kind of this imbalance between the activation of that limbic system and the prefrontal cortex. So in one way to think about it is almost like the teenage brain is hitting the gas while their brakes are out for repair. So they're going and going, and yet they don't have as much of this protective factor to help slow them down a bit. Some other changes that occur, so looking at that psychosocial development piece, is that teens are faced with a wide variety of new stressors during this time. So one of those stressors is just an increased expectation for maturity. And another big one is that they have higher expectations for their academic achievement, while at the same time, they're progressively going into larger schools. And so when they're in these larger schools, there's a tendency to have fewer opportunities for support in those close student-teacher relationships. So we have this increase in expectations and lower levels of support, which can create some stress for them. Their peer relationships tend to also be more intense during this time. So psychosocially, they have all of these pieces contributing to their stress level. Another piece of adolescent development that's important to know is that they are striving for autonomy and increasingly asking for more of it. And that's a normal part of their development, which sometimes can cause conflict because they might be striving for autonomy sooner than they develop those self-regulation strategies. And so they're striving for autonomy. It leads to some changes in the relationship that occur. And during this time throughout adolescence, the parents and teens, they have to reorganize their relationship in a way that is more egalitarian. So instead of the parent being on top and the adolescent being here, they have to shift it so that they tend to become more horizontal. And this is a progressive change. It's not an overnight thing that happens. I just hope it happens over time. And so as they're reorganizing this relationship, there's also an increase in that interdependence on each other and increase in the responsibilities that that adolescent has. So during this time, one thing that we have to do is find a balance between autonomy and privacy. During this time, teens tend to progressively view information about their private life or information about their life as more private, while parents still view it as their jurisdiction and want to know about it. And so if we can find and create this relational context where the teens can share this information and feel supported in sharing it without it feeling like a threat to their autonomy, that can be really helpful to kind of decrease this conflict that tends to come up of the parent wants to know more about what's going on in the teen's life, and the teen is saying, nope, I don't want to tell you, it's my life, I get to decide who knows about these things. So if we can create this context where the teen feels safer to share without their autonomy being threatened, that will kind of help decrease some of that conflict. And so one way we can actually do that is through the use of validation. So validation, it really helps open up communication and conversations in a way that helps people feel heard and understood and less threatened. And so I know for a lot of mental health providers, this isn't new information and still a helpful reminder, but validation, it's the communication of acceptance, the communication of that person's thoughts and feelings, that those make sense in this moment. And an example of validation would be like you're a teenager coming to you and saying, oh my gosh, I have all these things going on with school. I have this science project, I have a chemistry project, and then I have my music lessons, and then I have soccer practice after. I don't know how the heck I'm going to get all this done. Well, in that moment, a validating statement for them would be, wow, it sounds like you're feeling really overwhelmed right now. And so that helps them feel understood and heard, and like what they're feeling makes a lot of sense. Then it works to help strengthen that relationship, open up that door for communication. Another really cool piece about this is that it improves emotion regulation as well, because once someone feels heard and understood, it tends to lessen that intensity of that emotion for them. And then that gives them more space to kind of think more logically and problem solve. And so with parents, something to consider is parents often want to jump into problem solving right away for most of them, because it's hard to see their child in pain, and they don't want to see that. It's uncomfortable. So they're trying to solve the problem for them. But then this creates this dynamic where then the teen doesn't feel heard and understood. And then they either tend to escalate in anger, frustration, or tend to pull away and be less likely to come to you and talk about those problems. So then you know less about what's going on. And so with this, a cool piece is if you can step back and just focus on validating in the moment, that will actually help with your goal of keeping that communication open and helping them learn how to regulate their emotions and problem solve. So it's a really cool piece about this. But there are some typical barriers that parents tend to run into with this. One of them is that a lot of times parents think that, or just people in general think that validation means agreement. And validation does not mean agreement. They are not the same thing as one another. And so going back to that example with the teen coming and saying that they're so overwhelmed with everything, with all their school and activities, and then let's say all of a sudden they start talking about, you know, I'm just not going to do that science project, I'm going to fail it, whatever, like, screw this, moving on, I'm not going to do it. So I can validate in that moment that they're feeling overwhelmed and not necessarily agree with the fact that they're making that choice. But if I can stick with that validation, their feelings of being overwhelmed will likely decrease, and then giving them more space to problem solve and maybe shifting into this, well, I can work on the science project for an hour today and then an hour tomorrow, or if they need to, they can figure out that they can talk with their teacher and ask for an extension if they have too many other things going on to get it done on time. So it just creates that space for problem solving for them without threatening their autonomy. Another thing some parents say sometimes is, well, what if there's nothing valid to validate with what they're saying? But there's usually something that we can find. There's usually a piece that we can validate. And I think a helpful way to get through this one is to pay attention to the emotion that they're feeling. Pick up on that emotion and try to validate it. And sometimes parents or people say, hey, like, well, what if I get it wrong? That's okay, like that doesn't matter. What matters more is that you are tuning in and trying to hear them. And if you get it wrong, they'll correct you, they'll tell you. So another piece with validation too that I want to talk about to keep in mind is that there are certain types of invalidating statements that tend to happen. And so just keeping an eye out for those that come up. So for parents, just thinking about maybe times when you've had people say these type of statements to you and how it felt. Because usually it doesn't feel great. It makes you either escalate or pull away and not really want to talk to them anymore. But some of these types of statements are like giving advice, telling them what they should do or how to solve the problem. So problem solving is the other one. Another one is telling a person how to or how not to feel. So sometimes you might have a teen come to you, provider or parent, telling you about this friendship that blew up and that they're really sad about it and how difficult it's been for them. But as the parent and clinician, you've kind of seen how maybe unhealthy that relationship was. So then you tell them, oh no, don't be sad. Like, you should be glad you don't have that toxic friend anymore. Well, that's going to feel pretty bad to them to hear that in the moment. And they're just not ready to see the things that can come out of that relationship ending at that time. Two other examples of typical invalidating statements are one-upping the person or just trying to make it about you. And so these are things just to kind of look out for in the therapy room or in personal life, and just try to work on it and find those validating statements, validating the valid. So some other things, kind of shifting back into the changes that occur within the relationship. Research has shown that even though there are some changes in this interaction pattern and how that relationship is organized, the individual's perception of that quality of the relationship tends to remain stable. So a teen's relationship with their parents tends to be like fairly the same throughout adolescence. And I know this tends to be seen as this stereotypical storm and stress period of time. And research hasn't really supported that anymore. There's a research study that was done that showed that only 14% of early adolescents around age 12 reported turbulent relationships with their parents, and that was characterized by high conflict, low supportiveness, and then that number increased to 29% around middle adolescence, and then by late adolescence it decreased to 10%. And so with that, something to consider is that 10%, 29%, that's the minority. It is not the majority. So most of these relationships tend to remain fairly stable, though yes, there will likely be some increase in conflict during this time. So some other factors to consider when thinking about this relationship, and we can look at when we're trying to improve the relationship, are parenting stress and parenting practices. So parenting practices includes parental awareness, parental monitoring, parental supportiveness, and strictness. And so what parental awareness means is the parent's awareness of the child's needs and their emotions, but it also means their awareness of their own emotions. So when parents have a higher awareness, it tends to predict healthier psychosocial and psychological adjustment for their teenagers, and also is related to lower internalizing and externalizing problems for those teens. Now, when looking at parental monitoring, so that's those expectations that the parents hold for their teen and how they track to see if their teen is following those expectations. So research with that has shown that if there's a low parental monitoring during this time, it's related to more antisocial behavior, substance use, and just various delinquent behaviors. With parental supportiveness, we want higher levels of parental supportiveness because higher levels of parental supportiveness are related to reduced levels of depression, less psychological disorders, less externalizing behaviors, and just overall less behavior problems among youth. With strictness, this one is a little different because it's not high is good, low is bad. It's more of low and high levels of strictness tends to predict higher levels of problem behavior. So with strictness, we more so want to find this moderate level of strictness. And when there is this moderate level of strictness within that relationship, it tends to be a protective factor for adolescents. So with thinking about ways to improve the relationship, we can look at some of these pieces and try to see how as clinicians, how you can help support increasing the parental awareness of their own feelings and their teens' feelings and needs, how we can find a higher level of monitoring, so setting boundaries. And in the therapy room, that can be a helpful thing too, just to make sure that you're setting those boundaries with your patient and being able to uphold them and track them. And then also help in supporting the parent do this as well, helping increase that parent supportiveness, and then trying to find this moderate level of strictness for them. Now going into the parent stress piece. So in general, parenting during adolescence tends to be more stressful for parents, and it's just because of several changes that are occurring during this time. One of those changes is that there's this tendency for adolescents to want to spend more time with their friends and their peers. And so sometimes parents can view that as more of a threat to that parent-adolescent relationship. So that can create some stress and conflict. Also the assertion of autonomy in those family interactions, and that heightened just emotional arousal, emotional mobility can create more stress for that parent. But something to consider with parent stress, and parent stress is inclusive of parenting stress, so stress related to parenting your teen or other children, and just stress throughout the rest of their lives, so with work, other relationships, all those pieces. But when parents are under high stress, it tends to be associated with poor child and adolescent adjustment. It's also associated with an increased risk in child psychopathology, substance use, risk behaviors, and then it's related to more maladaptive parenting behaviors. So some of those parenting behaviors include like a lower level of warmth in that relationship, or more harsh or negative parenting, so maybe resulting in using more criticism or yelling in the parenting, or having stricter rules. It can also just overall with that lead to a diminished parent-adolescent bonding. Another piece to note too is that when parents are under high stress, it tends to change their perceptions of their child's behavior. So something that might typically be seen as a normative behavior. So one example could be their increase in negative emotions. A normative thing for them, the parent could then associate with more of a problematic behavior, or just viewing it in this way as more of an attack. And so that can lead to more conflict within that relationship and a decrease in that parent-adolescent bonding. So with an important piece to look at is how can we decrease this parent stress because of all of the negative associations when it is a lot higher. And one study that was done, it looked at using mindfulness-based interventions. And in this study, they compared those mindfulness-based interventions to a psychoeducation group. And they found that in the mindfulness-based intervention group with the parents, it showed that over time, the parents had a decrease in their distress and overreactivity to events. It also showed that they had increased ability to respond to events in ways that they chose rather than automatically acting on those emotions that come up. So instead of automatically acting on the anger, being able to notice the anger and then choose how they want to handle that situation. There's also an increase in the positive parenting behaviors and an increase in that closeness in the relationship and the bonding in that parent-adolescent relationship. And so this is something for clinicians to kind of be on the lookout for. If you notice a parent is under high stress, maybe making some suggestions for them to engage in some mindfulness-based practices. And for parents, it can be really helpful as well to consider adding in some mindfulness-based practices for you. So this is something we don't offer a specific mindfulness parenting, mindfulness-based intervention for parents at UCEBT. though our therapists are really, really well trained and knowledgeable in mindfulness and can help any parent with gaining those skills. But in addition, there are a lot of apps out there that people can look at to start kind of building on that mindfulness piece for them and just gain a lot more information about mindfulness. And I will say that there's tends to be this misperception of mindfulness, that mindfulness means meditation, but they aren't the same thing as each other. They can overlap with each other, but they aren't the same thing. Mindfulness is more about being able to be in the present moment, noticing what's going on with all of your five senses and just trying to be in that moment non-judgmentally. Another way you can look at it is more of this flexibility and attention. So this is a helpful intervention to introduce, or idea to introduce, when we notice that that parent stress level is high. So it looks like we have some time to talk about conflict in the parent-adolescent relationships. So I'll go through this. But there tends to be some typical sources of conflict within that relationship, and a lot of them relate to different expectations, mostly related to like what's appropriate behavior or changes in social expectations. So that's more related to changes in like responsibility level, maturity level that's expected. Different ideas in autonomy and just differences in social roles. So as I mentioned before, kind of that shift for teens to tend to want to spend more time with their peers. That can create some conflict if the parents think that the teens are spending too much time with their peers and not enough time with their family. But I want to say that conflict in that parent-adolescent relationship, it's normal, it's typical. And there's a lot of benefits to having this conflict, because that conflict, it's a helpful way to renegotiate that relationship. It's a helpful way to reorganize it more towards that egalitarian relationship. And once that, instead of, if we avoid the conflict, it never gets resolved, but if we work through that conflict, it's really helpful because it can actually decrease future conflict and increase that closeness in that relationship. And if that conflict is handled in like a helpful and healthy way, it can actually model for the teens how to be in any conflict. And so it's really important to think about what we're doing during that conflict. When looking at too much conflict, when we have too much of it, it tends to be related to just a poor well-being and poor psychosocial adjustment. So similar to a lot of other things mentioned here for associated negative outcomes, there's more risky behavior, substance use, poor school adjustment. Another one on here is a lower self-esteem, and then increase in the externalizing and internalizing problems. And so we want to make sure that we're having some conflict, because it's, when done in a helpful way, it can be really positive for that relationship. So we want to try to look out for if we're having too much conflict. But another thing to look out for too is what happens during conflict, because that matters. So how conflict is handled makes a difference on the outcome with it. And there's, what I'm going to talk about is just a small piece pulled from a larger pool of research. But with this, I felt like this was an important one to talk about, because it has a little bit more of clearer guidelines for things that we can try to do to help improve that relationship. But it's related to emotional variability. So research has shown that the greater emotional variability there is during conflict, the better the parent-adolescent relationship tends to be. So what emotional variability means is being able to express more of those positive and negative emotions during that conflict. So an example of that would be if a teenager comes home like late for late for their curfew, and they didn't text you, they didn't let you know that they were going to be back an hour late, and so you were worried and pissed off about it, whatever you're feeling in that moment. So an example of trying to, during this conflict that would come up about it, having that emotional variability during it would be saying to them, I'm really disappointed in you that you were late and you didn't tell me that you were going to be late. I was so worried about you and didn't know if you were safe. And I'm so glad that you are safe and that you are here. I love you and I'm glad you're safe. So it's having both of those aspects in there and trying not to get stuck on those, the one side of emotions during conflict. And there's been research done to show the positive outcomes from having this greater emotional variability during conflicts. So one research looked at mother-adolescent dyads specifically, and they show that the greater the emotional variability during the conflict in these interactions, they tended to report a better relationship quality over time. The teen felt more felt more support for their autonomy. There was less frequent conflict throughout time. And in this reorganization of the relationship that was happening through this conflict, it allowed it to happen just more efficiently. So thinking about how we can use this information to improve the relationship. So thinking about parents, trying to increase that emotional variability during conflict. So trying to get unstuck from the anger or the fear or whatever that is. Of course, it's going to be a part of it. It's going to be there, and trying to get unstuck from it so that it's not the only one that comes up. For clinicians who are helping parents and teens with this, just having them be able to express this variability more. So you could even set up things in the therapy room where, okay, if you say something of more of a negative flavor, then we're going to make a rule that you have to say something positive right after that during this conflict. So that can be a helpful way to give them practice on working with this. But another really cool outcome of having this greater emotional variability during conflicts is that there tends to be a higher disclosure from adolescents and just a more open communication pattern, which tends to be, a complaint from parents about their teens saying they don't talk to me as much. I don't know what they're doing. Well, if we can increase this emotional variability during conflicts, that will help open up the door for that higher disclosure from teens and open up those communication patterns to actually meet the goal that you have to improve that communication and know what's going on in their private life. Another important thing to mention for conflict in general is just modeling conflict resolution and emotion regulation. It is really important to do that. So for clinicians, how we manage conflict matters. And so we can also model increasing that emotional variability during conflict as well. We can say, I'm disappointed that you didn't that you were 15 minutes late again, and I'm happy that you're here. And just model how to resolve that conflict as well. And it also can help model for parents how to be during conflict and how to handle that. But parents, something to consider is your teenagers are always watching you. They are watching how you handle situations, and they're learning from you, whether you want them to learn that behavior or not. And even if you are managing the conflict well with your teen but not handling it as well in other relationships, so with bosses or friends, that's still communicating to them how to handle conflict with other people. And so we just want to be really aware of how that conflict is being handled and how we can shift it in a way that is going to be more helpful. So thinking about how I handling this conflict right now? Is that how I would want my child or my patient to be handling the conflict? And that can be a helpful guide to help us figure that out. But with that conflict, we want to have more of that positive problem solving and compromise, because when that is there, it is linked to lower levels of externalizing and internalizing behaviors. And another piece too that's important to know is that teenagers of parents who have a harder time regulating their emotions tend to also report having more trouble regulating their own emotions. And so that's something just to be aware of, where if the parents are struggling with emotion regulation, you're likely also going to see that from the teens as well. So we want to work on increasing the emotion regulation abilities, not just for the teen, but also for the parent. Another way we can kind of look at improving this relationship is adding in family rituals. And I think this is kind of a fun way to improve that relationship, because you can get really creative with it and you can find different ways. And so with this, I know we're busy as adults. There's a lot going on, a lot of different pieces that we're trying to juggle. And so with these rituals, it doesn't have to be something that's a huge, big thing. It can be something smaller. It could be like a special handshake or a hug before their activity, before they go to school. It could be that whenever you play a certain game that you have special family rules. Or you guys have a movie night once a month, and at that movie night you always have popcorn and certain types of candy. And so we can try to find ways to add it in that works for your family and can feel fun. But research has shown that when there's this presence of family rituals, it's often related to the adolescent having a greater sense of identity. They tend to also have a greater general sense of self-esteem when we're looking at where they're at in young adulthood. And there is a greater increase in family cohesion and lower levels of conduct disorder when we have these family rituals in place. So this is the last piece of information that I'm going to talk about to improve that relationship. And this one I think is it's a really cool one to me, because it was developed by one of my previous colleagues, Connie Schnews, and another one of her colleagues. They are both parent-child interaction therapy certified therapists, and they used the principles from parent-child interaction therapy to develop this protocol. And the protocol is called the Strategic Use of Emotion and Attention Protocol, so C protocol for short. And with this, we'll say it is not researched at this point. And so I don't have research to back up the protocol, but the reason I'm bringing it up and talking about it is because it has a lot of pieces that are based on principles that are really well researched and supported. And I thought it would be helpful to gain that information from those pieces that are included in this protocol. But with this protocol, it occurs in two phases, so similar to PCAT, but the first phase really focuses on increasing attention for acceptable behaviors and increasing that positive regard. The second phase is focused on intentional teaching and contingent follow-through. So I'm not really going to talk much about the second phase, because the first phase is where we're going to get more of this information on how we can improve that relationship. So that's where my focus is going to be. But within that first phase, to increase attention for acceptable behaviors, a huge one is praise, adding in praise. And so with this, it's just extremely helpful in general to try to find opportunities to add in praise. And ways to do that are by, setting a goal for a number of times per day. So you could start small, starting with, okay, 5 times a day, I am going to focus on giving my teenager praise. Or you can break it down by, I'm going to try to do it once in the morning, after school, at night. We can try to create a plan that can help them be more successful at providing this praise. And the goal is to get to this ratio of 5 positive interactions to 1 kind of negative or more demanding interaction, which during this time, it tends to be more on the demanding side, or tend to have a lot of things going on, short on time. So you get home and sometimes the first thing that you say to your kid, oh, did you get your homework done? How was the test? Did you do all of your laundry? Do you have everything together for piano lessons tonight? Just adding in all of these questions and demands on them. And so we want to try to kind of re-level it out to increase this positive end and hold up that side. And we're praising things that we want to see more of, because usually when we praise someone for something, it feels really, really good, and they want to get more of that praise. And so they're likely to keep doing that again. And adding in this praise isn't this one and done thing. It's not like one time, okay, I'm going to see this complete change in behavior. They're going to all of a sudden start doing the dishes every time, the first time I ask them. We have to be consistent, and we have to add it in. But when thinking about adding in that praise, you can think about things that you want to see more of, and or things that you really like, and add that praise in. And so some ways that you can do that is if the teen has a hard time getting up on time, just letting them know, like, the day that they get up on time and on their own, like, great job getting up and ready on your own today. Like, we made it to school on time. That's awesome. Or if your teen is telling you about their day and how it was going, which sometimes can feel like pulling teeth. But if they're actually opening up and talking to you about that, you can let them know, hey, thanks for telling me about your day. Like, letting them know that you notice what they're doing and that you really like it. And that will likely increase that. And an important piece with this is sometimes we get stuck in saying, well, I don't why would I add in praise for something that is expected of them? Like, they're expected to get their homework done. They're expected to do their chores. Well, I'm an adult and I don't like doing my chores. But when I do the dishes and I take out the trash and I do those things, it feels really good when my fiance notices it and tells me, oh, thank you for doing that for me. That feels really good, and it makes me more likely to keep on doing it. But if I never got recognition for that, I'd probably eventually just stop taking out the trash or really reluctantly doing it. And just kind of build up a lot of negative feelings about it. And so it can help with that piece. And so with teens, yes, they might have an expectation to do the dishes. And if we want to see them keep doing it or have less of a fight over doing the dishes, it can be really helpful to add in that praise for, hey, thanks for doing the dishes. Wow, I'm so happy that I didn't have to ask you to do it a second time before you did it. That can be really helpful just to get more of those things that we want to see from them. The other piece to the C protocol in that first phase is adding in this positive regard. So that positive regard is like spending 5 to 15 minutes per day with your teen. I know sometimes that can be really hard to find that time. And so we can try to find times that it works in your schedule, or that it's convenient for the teen, for the parent to do, because if we can find a time that is convenient, they'll likely be more successful at doing it. So you could even do it on the way to school or on the way to an activity. But during this time, we want it to just feel like this really positive experience that doesn't have a lot of demands. And we can do this by kind of increasing that physical affection during that time. So that physical affection could just be being in a closer proximity to them, showing more eye contact, smiling more, being more inviting to them. And then providing more positive comments like, good morning, you look awesome, I love you, like, oh, how great it is to see you. Just adding in more of those positive comments in there. This could also be a great time to add in some of that validation that I talked about earlier. But we just want this to create this space where it feels really good to be talking with your teen instead of getting stuck in this, oh, that demanding, like, did you get your homework done? Did you do this? Like, how was your test? We're trying to kind of rebalance that out by adding this shorter period of time every day where it's more of these positive interactions. But an important piece of during this 5 to 10 minutes, a big thing that we're trying to avoid is adding in any criticisms, commands, or questions during this time. You know, criticisms in general just aren't the best. So like, oh, like you're a terrible student. It just tends to decrease the teen's self-esteem, making it even harder for them to try hard and work hard to become a quote unquote better student. It also just doesn't feel great and lowers their self-esteem. So even outside of these 5 to 10 minutes, be helpful to avoid those criticisms, but especially during these 5 to 10 minutes, we really want to avoid those. We also want to avoid commands during this time because commands can seem pretty demanding and punishing for the teen. So we want to try to hold back on those. And sometimes we're giving commands and we don't even know that we're giving commands. Those could be things like, hey, look at this, come over here. Or more directive, do the dishes, get your homework done. I'm just trying to put those on a pause at the time. And then questions. It's, you know, sometimes it can be hard to get a teen talking without asking any questions, but to the best of our ability, we're trying to avoid questions during this time. So when we have question after question after question, like, how was your day? What did your teacher say? How did this go? It can feel pretty demanding to them instead of just feeling like they have this open space to talk. And so we're going to try to keep those questions to a minimum. And if you can imagine, whenever someone has asked you like question after question after question, you tend to kind of get over the conversation and be like, I'm done, I don't want to talk anymore. And so it can shut down the conversation instead of open up the conversation. So one piece that I do want to talk about from that second phase of the C protocol is whenever you are dealing with problem behaviors, we want to try to eliminate emotion. So that doesn't mean you're not going to have emotion. Of course, you're going to have emotions about it, but we're trying to keep those inside. And when we're talking about it, having a more neutral manner when we're talking about those problems. And so going all the way back to that example with the teen coming in late and being late for curfew and not letting the parent know. You'll notice earlier when I was talking about it, how I was saying, you know, I was really disappointed in you for coming home late and that you didn't let me know. So saying it in this more neutral, calm manner, or you can think about it as being more robotic if that's helpful for you. Because usually when we add in that emotion during problem behaviors, like if I just went off, just like, I'm so freaking disappointed that you're late. What the heck is going on? Why didn't you tell me? You can tell I don't do that often. But that increase in emotion just really contributes to the escalation in that conflict and doesn't usually let us kind of resolve it in a way that's beneficial for either the teen or the parent. So we want to try to keep that lower. So if you're in a conflict, you notice you can't keep it in any longer, take a break. That's okay to take a break and come back to it because it's going to be more helpful for you to do that than it would be to continue with that conflict. But again, us keeping the emotions in more of a neutral, robotic way during this also teaches the teens how to be when they're receiving those consequences. So the calmer and more neutral we are when delivering the consequences, they'll also learn to be calmer and more neutral when receiving those consequences, or at least more so than they would have if we're increasing that emotion in that situation. And it also, again, models for them how to handle difficult situations, where, again, we are always teaching teens how to behave. So whether it is the clinician modeling and teaching the teens how to be during conflicts, or the parent teaching them how to be during conflicts or with other people, we're always modeling that for them, even when you don't think that they're watching. And that was the last piece of the presentation.